Welcome to Pediatric Advice Hub. Measles, also known as rubeola, is one of the most contagious viral diseases affecting humans. Even though it was declared eliminated in the U.S. in 2000, outbreaks still pose a serious threat to public health. These outbreaks are often linked to communities with low vaccination rates. In this session, we'll cover everything you need to know about measles. We'll discuss its symptoms, potential complications, and how to prevent it. Together, we can work to better protect our children from this preventable disease. Measles is caused by a virus called morbillivirus, part of the paramyxovirus family. It spreads easily through respiratory droplets, lingering in the air for up to 2 hours after someone coughs or sneezes. Just a few moments in a room with an infected person can put you at risk. So stay informed and protect yourself and others from this highly contagious virus. After an incubation period of 7 to 14 days, symptoms begin to show. First up is the prodrome phase, the early stage of the illness, lasting 2 to 4 days, where you'll experience a high fever, cough, and conjunctivitis, red eye. Then come the Koplik spots, tiny white lesions in your mouth, a pathognomonic diagnostic sign of measles. Next is the rash phase, starting 3 to 5 days after the first symptoms. Erythematous maculopapular rash beginning at the hairline. The rash spreads downwards to trunk and extremities, often merging together, accompanied by a fever over 104 degrees F. So, if you notice these signs, it's time to take action and seek help. Measles isn't just a rash. It can be life-threatening. Common complications include ear infections and diarrhea, affecting many children. Severe complications like pneumonia can occur in 1 in 20 children, and encephalitis can lead to seizures or deafness. Tragically, 1 to 3 in 1,000 children may die from respiratory or neurological issues. Pregnant women face risks too, like preterm birth and low birth weight. Long-term effects can be devastating, with conditions like SSPE, subacute sclerosing panencephalitis, a rare, progressive, and usually fatal complication of measles that occurs in the central nervous system, leading to mental deterioration, muscle jerks, seizures, and coma. It is caused by a mutated form of the measles virus that lies dormant in the brain for years before reactivating. Who's at risk? Complications hit hardest for children under 5. Adults over 20 are also vulnerable. Pregnant women need to be especially cautious. Anyone with a weakened immune system is at risk. This includes those with HIV or leukemia. Stay informed and protect yourself and loved ones. Worldwide, measles remains a leading cause of vaccine-preventable child mortality. In the U.S., most outbreaks occur in unvaccinated communities. These outbreaks are often introduced through international travel. Vaccination is crucial to protect our children and communities. Let's work together to ensure every child is vaccinated. The MMR vaccine protects your child from measles, mumps, and rubella, potentially serious diseases caused by viruses. Almost everyone who has not received the MMR vaccine will become ill if they are exposed to these viruses. The vaccine keeps your child from missing school or childcare, and you from missing work to care for your sick child. Vaccination also limits the size, duration, and spread of outbreaks. For measles, the MMR vaccine protects your child from getting rash, high fever, and life-threatening complications from measles. For mumps, the MMR vaccine protects your child from getting a fever and swollen glands under the ears or jaw from mumps. Also protect your children from possible infertility complications in males. For rubella, the MMR vaccine prevents your child from getting a rash and fever from rubella. The vaccine also prevents your child from spreading rubella to a pregnant woman whose unborn baby could develop serious birth defects or die if the mother gets rubella. Vaccination is key to a healthier future, and the MMR vaccine is at the forefront. It's simple: 2 doses. The first between 12 to 15 months, and the second at 4 to 6 years. Children usually get the measles, mumps, rubella, and varicella MMRV vaccine, which protects against chickenpox too. 1 dose gives you about 93% protection, but 2 doses boost that to 97%. To achieve herd immunity, we need 95% of the community vaccinated. Older children, adolescents, and adults also need 1 or 2 doses of MMR vaccine if they don't have evidence of immunity. Doses should be separated at least 28 days apart. Most people who are vaccinated with MMR and MMRV will be protected for life. Vaccines and high rates of vaccination have made these diseases much less common in the United States. Anyone traveling internationally should be fully vaccinated before traveling. Infants 6 to 11 months old should get 1 dose of the MMR vaccine before travel. Then they should get 2 more doses after their first birthday. If you don't have immunity against these diseases and become exposed to them, talk with your doctor about getting the MMR vaccine. It is not harmful to get the MMR vaccine after being exposed to measles, mumps, or rubella. Doing so may prevent later disease. If you get the MMR vaccine within 72 hours of initially being exposed to measles, you may get some protection or have a milder illness. In some specific cases, you may be given a medicine called immunoglobulin, IG, within 6 days of being exposed to measles. This provides some protection against the disease or illness is milder. Unlike with measles, MMR has not been shown to be effective at preventing mumps or rubella in people already infected. Be aware, pregnancy and severe immunosuppression are contraindications to getting the vaccine. Remember, vaccination not only prevents measles but also saves lives by reducing the severity of complications. There's no specific antiviral therapy for measles infection. Management is all about support, hydration, antipyretics, and vitamin A for kids. We need to keep a close eye on complications too. If pneumonia, encephalitis, or severe dehydration hits, hospitalization is a must. Stay vigilant and proactive. Measles is still a serious threat, and it's more contagious than you think. But we have the power to change that. Healthcare professionals stand on the front lines, ready to tackle challenges head-on. The first step? Rapidly identifying suspected measles cases and reporting them to public health authorities. Isolation of patients is crucial to prevent the spread of this contagious disease. But it doesn't stop there. Vaccination counseling is key, especially for those hesitant about vaccines. We must engage with our communities, addressing concerns and providing accurate information. Together, we can protect public health and ensure a safer future for everyone.
Thank you for watching Pediatric Advice Hub. We're here to support you with trusted parenting guidance and child health tips. All our videos are based on recommendations from the American Academy of Pediatrics. This helps you make safe, informed decisions for your child. Please remember, our videos are for educational purposes only. They are not medical advice and do not replace a consultation with your pediatrician. Every child is different, so if you have any concerns, always speak with your child's doctor. Be sure to like, subscribe, and stay tuned for more helpful tips in our upcoming videos.